here's a patient. We did a posterior heel spur. We just did this. Today's October the 8th or 9th? 9th, 2019. She had a posterior heel spur. You know, we've done some videos on minimally invasive procedures for retro-calcaneal heel spur. This is a patient that's not appropriate with. You can see that she's 3 weeks post. You can see her cast still, so we're getting ready. We're taking that off. What we had to do with her, we had to detach her tendon and reattach it with bone anchors. So I think we used striker, but you can use any bone anchor. So basically I'm going to show you her foot and show you how we do the incision and the difference between that and minimally invasive surgery. She told me now, I asked you from 1 to 10, what was your pain now at 3 weeks? Your pain's what? 1. 1. So she said she's about at a 1. So there's not a remarkable difference in the recovery in terms of how patients feel and how much pain they have. The difference is this is a lot longer recovery. It takes longer to get over this and to go back to normal activity. Minimally invasive surgery is not any better. This is a good surgery, the open surgery. We'll show you the wound and all that when we get the bandage off today. So here's our pre-op x-ray. You can see if you look at the back of the heel, this approach is it'd be pretty hard to do minimally invasive because you got a retro-calcaneal spur. But even your dorsal bump there, which is kind of like the Haglund's portion, look how sharp that is and how much involved that would be. So this would be very difficult to do with a minimally invasive procedure. So we opted for an open procedure on this patient, and also detachment, reattachment of the Achilles tendon. This procedure works well. It's a high success rate. And the way we do it now, we kind of use we create a flap, so we kind of prevent dehiscence you can get with some of these posterior heel spur removals. So these patients are not the same as our MIS patient. She'll be in this cast, usually non-weight bearing for the first 3 weeks, and then you can see where we put a weight bearing place on her cast, allowing her to weight bear after about 3 weeks in the first cast. So this requires a much longer post-operative period. With our minimally invasive procedures, the patients are back on their feet within 2 weeks and walking, in a cam walk. Where these patients are in a cast. So you can see how much the incision is fairly large. The reason I do this large incision like this is because I create a flap on that proximal portion where that first incision is down into the deep tissue, and we also carry over the peritoneum with it as well. So we keep that flap good and vascular there, and you get a lot less issues with dehiscence. That's one of the issues with open procedures in the back of the heel. If you do a direct straight line approach, you can get dehiscence, and those are pretty hard to heal if you get that. So I just wanted to show you that and the difference between what we get with minimally invasive surgery, how it looks, and the traditional one we just showed you there.